Hi, I'm Dana Pierce, and this is a demo of our current product. I'm going to show you a few of the features, but not everything. This is the landing page for clinicians. You can see their current schedule for the day. They can see urgent messages and urgent tasks that have been assigned to them. We'll go to the patient card. So each card provides a summary of the patient. You can see if a patient is considered low risk or high risk. Click on the patient card. It will take you to their full patient file. These are all of their recent appointments. This is their current treatment plan. You can edit the treatment plan and update it. You can go to their assessments. These assessments have been assigned to the patient based on their diagnoses. These assessments track patient symptoms. So each individual assessment shows patient symptom progress, and you can see this symptom progress tracked on a graph. These are documents that the patient needs to sign for consent to treatment. These are tasks that are critical to clinical collaboration. So what that means is we have multiple providers for this patient that need to be able to discuss patient progress. So Dr. Jones can assign this task to the therapist, Walter Perlman, and they can discuss this task in the comments here until the task is complete. Then we go to the DBT tracker. This is filled out every day by the patient, so clinicians can see symptom progress, including sleep, medication compliance, urges, are the patients acting on these urges, intensity of emotions. This diary card can be customized based on individual patient needs. We can also see all of the intensity of emotions and how they interact with one another. We can also see all of the therapy skills that the patient has been using. What skills are they using the most often? What skills do they find to be the most effective? This allows therapists to have more constructive sessions with their patients. Then we'll go to the medical side. So this is for medications that are being prescribed by psychiatrists. They can see active prescriptions, they can see past prescriptions. We'll go to back here and we can do a patient intake. So this is a really in-depth 11-page intake that gets the full patient history and really all the information that a clinician will need to treat the patient properly. We'll go to documentation. So we have individual documentation here. This is where a clinician would convert their rough psychotherapy note into official documentation. This official documentation would be shared with anybody else who has access to this patient's chart. We can also see other clinicians' documentations, including psychiatry notes, group notes that are relevant to this patient, and other notes from dietitians and nurses. We can also go back to group documentation here. So this is where the therapist manages all the groups that they lead and do the documentation for these groups. We'll go to messaging. So this is a all therapist group message where clinicians can communicate in a group. Then we have one-on-one clinician messaging. So this is where clinicians can schedule consults with one another. They can also do a task assignment that goes directly into a patient's chart for this specific provider that they're talking to. We can also do communication between providers and patients. So this is a group chat for a therapy group that all of the patients are in where they can talk about upcoming homework and whatnot and what's going on in group, what's worked well for them. We also have one-on-one communication with providers and their patients where you can schedule an appointment with your patient. You can also do this in scheduling. So this is billing. You can see all of the information about a patient's insurance, how close are they to their out-of-pocket max. We can see billing here, so you can talk to a patient about their most recent bill. This is the schedule. So this is where a clinician would see their schedule. They can go and start documentation for an individual appointment here, or they can go into the appointment. Once they go into the appointment, they can see this pre-session assessment that a patient's already filled out, and you can see what they want to work on. You can meet with your patient, and then whenever you're ready to leave, you'll see the post-session assessment that the patient filled out, and you can see progress from the beginning of the session. And then we have here where clinicians can manage their settings of their notifications. And then we'll go back to the very beginning with the patient cards. Thanks for your time.